what about if you are getting a prescription, let's say, from a specialist? At that point, what kind of relationship do the specialist and the doctor, your primary care, have in managing that prescription?
So there are a lot of times that a specialist will prescribe a medication to a patient, and the primary care physician won't know, of course, at the time of that visit. Frequently, a specialist will send what's called a consult note to the primary care physician, kind of summarizing what that visit with their patient was about, what recommendations they made for evaluation, what recommendations they made for prescription management, and that information comes over to the primary care office. Now, that process does take some time for when the consult letter makes it over and gets scanned in. So I oftentimes will encourage patients, again, anytime you get a new prescription, like I mentioned earlier, write down who gave it to you. So that way, when you do come in for your visit, your primary care office can update your medical record. And also, if your primary care physician needs to speak with the specialist, they know who prescribed what medication and why. And we can get a little better understanding and be on the same page.
And that little paper that you talk about, that helps too.
Yeah, it's just it's very helpful because we all are very busy, and we know a lot of these names of prescriptions are really hard to pronounce. They're really long, and actually a lot of them sound the same, and so it can be dangerous to try and have a physician kind of guess what medication you're on.
Right.
It's always safer if you have it in front of you. And also nowadays, in case you're out of town or have to go to a facility that doesn't have your healthcare record, it's really important to provide that information so that your care can be safe.